Every day, 43 children are diagnosed with pediatric cancer. This is according to cancer.org. Although cancer in children is rare, it is the leading cause of death by disease past infancy among children here in the United States. Joining us this morning to talk more about pediatric cancer, the many common forms of it, and resources for these patients and their families is Dr. Eric Sandler, Chief of Pediatric Oncology at Nemours Children's Specialty Care. Good morning, Dr. Sandler. Thank you so much for joining us.
Good morning, and thank you for having me on today.
Yeah, we so much appreciate you coming on. Childhood cancer is rare, but it impacts so many children.
Yeah, so if we put it in context, children fortunately it's only about 1% of all the cancers in the United States occur in children. But the impact that it has on those children and on their families and communities is really quite staggering.
With that, what is the most common form of childhood cancer?
So the most common forms, leukemia is the most common cancer we see in children. And then the second most common would be brain tumors.
Can childhood cancer affect or impact adult patients?
So in general, the types of cancers that children get tend to be a little bit different than those that we see in adults. And again, thankfully for us and for our children, they are, in general, many of them are more susceptible to treatment than the same cancers when they occur in adults or the ones that are more specific to adults.
I ask that because my family, my sister-in-law, at the age of 27, she was diagnosed with embryonic sarcoma, which, from my understanding, is a form of pediatric cancer in the liver. And it was very rare, and the fight was very tough and very long, but she beat it. And so she's thriving today, 2 years post. And so this certainly hits home, and I try to shed as much light on childhood cancer and how it impacts families as much as I possibly can.
Well, congratulations to her. And yes, so that is a very, very rare form of cancer, even in children, but is more common in children than adults. And that's one of the reasons why all of the children's hospitals in the country try to work very, very closely together so that we can learn what treatments work and how to better take care of the patients. And that's been very, very important and resulted in some markedly improved outcomes for children who are diagnosed with cancer.
Absolutely. We introduced our audience to a little fellow by the name of Liam Mickley. He's currently battling medulloblastoma, and so having many conversations with his family and his mom, we want to shed light on childhood cancer. People watching today, how can they get involved in helping these folks, these patients, and also their families?
You know, we say often it really does take a village to take care of a child who has cancer, and it impacts so many aspects of our community. So, you know, not only is the child impacted, the family is impacted, perhaps school peers are impacted, and teachers, and it just goes on and on, the staff taking care of them. We are so blessed in the Jacksonville area to have a number of community organizations who really do come in and help in many different ways. And I think, you know, having Nemours Children's Specialty Care and Wilson Children's Hospital in our community, for those who don't know, we are really ranked very highly among children's hospitals around the country. And so I think our community is blessed to have those organizations. So there are so many things that people can do. They can keep up and contribute to what's going on in those institutions. There are community organizations that really do tremendous work in helping these families just get through the day, and then supporting the research that's being done that has resulted in childhood cancer cure rates going from 20 to 30% just 30 years ago to now almost 80% of all children who are diagnosed with cancer are cured.
Wow, that's incredible. Dr. Sandler, thank you so much for joining us this morning. We appreciate it.
Thank you. Take care.